Peptides are chains of amino acids, typically ranging between 2 and 50 amino acids. They are chemical messengers and they direct a particular part of the body to do a particular task. So they're signaling molecules actually.
Signaling molecules. So peptides are essentially instruction messengers that tell the body to do stuff.
That is correct.
Your health is shaped by more than symptoms. Through real stories and expert insights, we explore how your genetics, environment, and daily choices affect your well being. We uncover root causes and share practical tools to help you find the healing you need. Welcome to the Forum Health Integrative Medicine Podcast.
Welcome back to the Forum Health Integrative Medicine Podcast. If you've been hearing the word peptides everywhere lately, from social media to longevity clinics, and wondering whether they're hype or the future of regenerative medicine, this episode is for you. Today, I'm joined by Dr. Lynese Lawson, board certified by the American Academy of Anti-Aging and Regenerative Medicine. We're breaking down the science behind peptide stacking, specifically the glow up combination of BPC 157, GHK-CU, and TB500, what they actually do in the body, who they're for, and what patients need to know before jumping in. Let's get started. Dr. Lawson, thank you so much for joining me. I'm so excited to talk about peptides and the glow up stack today. How are you doing?
Doing well, thank you.
Good, good, good. Well, I can't wait to dive in. So, if you're good, are you ready to dive in with me about peptides and the glow up stack?
I'm ready.
Let's do it. All right. So, first, I'm going to start with peptides. What are they? Can you give me the 30-second elevator pitch on what peptides are?
Peptides are chains of amino acids, typically ranging between 2 and 50 amino acids. They are chemical messengers and they direct a particular part of the body to do a particular task. So they're signaling molecules actually.
Awesome. Signaling molecules. So, peptides are essentially instruction messengers that tell the body to do stuff.
That is correct.
Perfect. Awesome. So today we're going to be talking about three peptides combined together that make up this glow up stack. And putting all these three peptides together is stacking peptides. So stacking peptides, what does that mean and why do people do it?
So stacking peptides means you're using more than one peptide. So you're using a different peptides to get a desired effect or outcome. So for example, with the glow up stack, it is a combination of BPC 157,
Mhm.
GHK-CU, which is a copper tripeptide, and TB 500, which is a fragment of thymosin beta 4. So all of them work synergistically together. So, for example, the GHK-CU is really good for promoting collagen and elastin production. The BPC 157 is for more for repair. And then the TB 500 has some regenerative properties. So the three of them together really work well to improve the integrity and firmness of the skin. It helps to reduce fine lines and wrinkles. And again, it helps the body actually to produce more collagen and elastin. So we already we already make collagen and elastin, but as we age, we don't make as much collagen and elastin. So the peptides, particularly the glow up stack, it tells the body to do that task of making more collagen and elastin and improving the skin integrity.
Awesome. So stacking these three peptides together actually creates more synergy. So the concept of stacking peptides together is putting peptides that have a specific goal or outcome, putting them together to create more synergy. Essentially, not 1 + 1 + 1 equals 3. It's more like 1 + 1 + 1 equals 10 or 11 because you get this amplified signaling cascade going on.
That would be correct. That's exactly what they do. So, for example, now I have used the glow up stack And my primary purpose for using it was to improve my skin.
Hmm.
But what I found was that I had been having some back pain, and I think because of the TB 500 and the BPC 157, my back pain actually improved. So, yeah, it's a great combination. It really is.
Awesome. So the glow up stack, which is made up of three peptides, is the outcome and the goal, kind of what it sounds like, is to have a little glow up, right? To age gracefully. So it's not necessarily just about the outward appearance, but it is about regenerative signaling. These three peptides send regenerative signals to the entire body. The glow up is happening not just outwardly, but regenerating other areas of the body.
That is correct. That is correct.
Very cool. So let's break down each of the peptides that are in the glow up stack. So let's start with GHK-CU. What does that peptide do?
So it's a copper tripeptide and it signals the body to make more collagen and elastin. So as we age, women notice that their skin doesn't look as plump and firm as it once did. So the GHK-CU actually has a, a significant benefit on skin regeneration.
Okay.
So, yeah, so that one can be used alone or it can be used in the stack that we're discussing today.
So GHK-CU, naturally occurring copper binding peptide, is is known for collagen stimulation, skin regeneration, hair support, and cellular signaling for repair. And some of the benefits that you can see or expect would be visible skin benefits, anti-inflammatory, and just overall signaling your body to rebuild healthier tissue. And you notice that outwardly because of the elastin and the collagen stimulation.
That is correct. And GHK-CU has been beneficial for example, there's another peptide that people are using, and it's the GLP-1s and the GLP agonist. And
Hmm.
many times people who lose weight rapidly will experience significant hair loss. So the GHK-CU in particular, and even combined with that glow stack, can even help to improve and the hair loss.
Very cool. Would that also, so with GLP-1s, a lot of people who are experiencing rapid weight loss also are starting to see a little bit of like the sunken in face. Could
Right.
GHK-CU also help with that?
Actually, I think probably maybe a little bit, but
But
probably
that's more
people,
fat loss.
yeah, the people are
Okay,
not consuming enough calories, are not really consuming enough protein. But yeah, if you've got to really maintain your caloric intake and exercise when you're using a GLP agonist.
that makes sense.
Hmm.
So, second peptide to discuss that's part of this stack is TB500. What is TB500? What is it known for?
TB 500, I said earlier, it's a fragment of thymosin beta 4, and it
Hmm.
has a lot of recovery benefits. So, if, say, for example, someone had an extensive shoulder injury, they might have torn a labrum and have significant pain. So, the TB 500 can really help and with recovery. So now it also helps to repair, but when combined with the BPC 157, you get decrease in inflammation in the tendons, ligaments, and joints, but you get better recovery when you add the TB 500 to that particular peptide.
They
So
work
yeah,
in synergy together. They build
they
each other.
right. They
Awesome.
definitely work synergistically together. And
Awesome.
depending on the condition, now it's the peptide dosing is not a one size fits all. So
Mhm.
for the glow stacks, so for example, most of the stacks contain 2 milligrams of GHK-CU and then 500 micrograms of the TB 500 and 500 micrograms of the BPC 157. But for someone who has had a significant injury, you can even increase the dose of the TB500 even up to 2 milligrams. So you don't just, if someone had an injury, I would say the glow stack would not be appropriate for them. We would have to change your dosing and maybe not use that particular stack, but the TB500 and the BPC 157 definitely work quite well together.
Wonderful.
At Forum Health, we uncover the why behind your symptoms. With advanced lab testing, hormone optimization, and cutting-edge therapies, we help you heal and perform your best. And now, through shopforumhealth.com, you can access physician-grade supplements trusted by our providers, supporting everything from adrenal health to focus and longevity. Learn more at forumhealth.com and explore supplements at shopforumhealth.com.
So we were just talking about TB500, what it is, and what the benefits are. So do you want to kind of back up just a little bit, Dr. Lawson, and kind of start around what is TB500 and what can patients expect results-wise from taking that?
So TB500 is a fragment of thymosin beta 4. It has a lot of regenerative and recovery benefits. So if someone had a significant injury, they would use a larger dose of the TB500, whereas if it's just being used for skin benefits and, having a glow up, then you would use that in a lower dose. So as I was saying before, there's not just a one dose fits all. You really have to look at each person's condition and dose them accordingly. But, I have a colleague who really injured his shoulder significantly, and he had to use the TB 500 and the BPC 157 for about 3 months, but he had significant recovery and he used the two at a higher dose.
Mhm.
So that particular stack would be called the Wolverine stack. So they're different combinations of peptides that can be used for different conditions.
Right. So TB500 is definitely known for its regenerative qualities and increasing recovery time. And when you look at it in the glow stack, depending on what goal or outcome you're looking for, you might have a lower dose of the TB500, but TB500 can be used for a lot more than just the glow up stack. And it works very well synergistically with BPC 157. So at higher doses, you're looking at more injury, recovery, things like that. In the glow up stack for the TB500, you're more looking for overall regeneration of the tissues and supporting the cellular processes of the body.
Right. Skin rejuvenation.
Skin
Now, I
rejuvenation.
tell people it's not going to be, you're not going to get the results that you would get with a facelift, but
Right.
it does definitely improve the clarity of the skin.
Skin texture,
Firmness.
firmness, having a little bit like more youthful glow to the skin,
Exactly.
hydration.
Right.
Beautiful.
Exactly. But again, they don't work by themselves. You have to have a good diet. You've got to use good
Hmm.
skincare. So it's just a part of the regimen to have healthy skin.
Yeah. And you were
Is it?
mentioning that, yeah, that TB500 works really synergistically with BPC 157, which is the third peptide of this glow up stack. So BPC 157, what is that peptide and what does it do in the body?
So BPC 157 it's made up of a gastric protein. And so not only does it
Yummy.
have so not only does it have some uh, benefits of decreasing inflammation in the skin, it also helps to heal the gut. So not only do I use it for people who are doing the glow up stack. If I have someone with ulcerative colitis or Crohn's disease, I will use the BPC 157 in that patient as well. So again, you use them for different purposes and different conditions. And the way you use them depends on what you combine with them, whichever peptide you combine.
BPC 157 and with an I've seen being used as a very popular peptide for gut health and gut healing. And that makes sense in the Glow Up peptide stack, because I think a lot of times as integrative and regenerative practitioners, your gut is a reflection of, like, your skin is a reflection of your inside, right? So it makes sense, BPC 157 being part of the Glow Up stack, not just because it's the body protection compound and systemically it is just helping your whole body with repair signaling and things like that, but it's also a really great peptide for GI conditions. And again, Glow Up peptide is kind of sounds like more of like a vain vanity type of a peptide stack. But when you look at the peptides in the Glow Up stack, yes, you're getting more elastin and collagen and this nice outward appearance and this glow. But a lot of this has to do with like just healing and providing regenerative signals to the body. And the end result is a really nice outward complexion, and you feel really good about how you look.
I would agree with that.
Yeah, I think that that's a really important thing to understand is that when people look great because their skin and their hair are looking really good, they have to have a certain amount of internal microbiological and cellular health in order to achieve that, right? So I wouldn't say that I use TB 500 primarily for looking good. I use it for repair, right? Like Dr. Lawson was saying about this friend of hers that used it for several months at a higher dose. That doesn't mean it doesn't work for that. It works great. Like, you're going to look great because your body's repairing a little better. And if you're generally healthy, I think a glow stack, you're going to get really impressive results because you're generally healthy. If you're injured, you're going to use that glow stack. It's going to help you repair. And you might not glow quite as quick because you got to get all the repair done first before you start to really glow. Yeah. So, and I love BPC 157. I had a guy I gave it to a week ago. He had pulled his hamstring. An older guy. He was going on a trip, I think, to Germany or something, and we just injected in the 3 places where it hurt the most. And he actually contacted me immediately. Like, I did it on a Friday. On Monday, he was like, "This stuff is the best ever. Where do I get more?" Right? Like,
Right.
it worked that fast. So, it's a great
I
for it.
recommended it for a guy who had not been able to work out. He had low back pain. I don't remember exactly what the injury was, and he was doing physical therapy. And I said to him, Why don't you try the Wolverine stack with the combination of the TB 500 and the BPC 157?" And I spoke to him earlier in the week, and he said, "My back is completely normal. I'm able to get back in the gym." He said, "This is amazing." He was very happy. And it maybe took about 2 to 3 months. So it wasn't immediate because he had significant pain, but it really is amazing. And I'm a believer because now I use the Glow Up Stack because when I look at myself on Zoom all day long, you get to look at your skin. And I thought, okay, well,
Yeah.
let's try this.
But you look amazing, Lynese.
Oh, well, thank
Yes.
you because of the glow up. But I had been experiencing back pain for about a year. And, I was taking meloxicam, I was getting Thai massages and trying to stretch, and nothing really worked. I mean, I still had significant pain. And after about 30 days of using the Glow Up Stack, I noticed that I really didn't have any pain anymore. So I'm not using the Glow Up Stack currently. I'm just using the BPC 157 and the TB 500. But I cannot believe how much better I feel.
So I started using thymosin beta 4 primarily for patients that had chronic illness.
Hmm.
And that's because it lowers pro-inflammatory cytokines, right? It lowers interleukin 1 beta, it lowers TNF alpha, it lowers interleukin 6. Those are all these sorts of things that will be high when people have chronic fatigue syndrome or fibromyalgia. Um, but that's also part of why it is giving you anti-inflammatory repair signaling, right? So that's the
Hmm.
beauty of this is it can be used for longevity, but it can
Right.
also be used for chronic illness recovery. And people are like, well, those are 2 opposite things. No, actually, those are the same exact pathway. We're talking about the, these immune cascades that happen. And either they keep us sick because we get stuck in that pathway, or we need to reduce that acutely so that we can then recover and repair. So,
You know, I have to look at myself after being recorded for the podcast and all that stuff, and I use different peptides for different reasons. And one, it setting up the expectation for when to start noticing these results is one thing that I wanted to jump into, but it's the inflammation markers that when you start seeing those lower and lower and lower, your body starts to become less puffy and puffy and puffy. And I actually noticed a relationship between my outward glow up and my inflammatory markers. So I was watching my HSCRP markers and I was watching my inflammation continue to go down, down, down using the BPC 157 and even the GLP ones. I do microdosing of that to help with lowering inflammation. And I can notice the glow up in my face, the decrease in the puffiness, the more brightness, and even just like the more energy that I feel, the less pain, the less brain fog and fatigue. Like those are all also markers of longevity and regeneration, which I think is more of the core of what the glow up stack is. It's not necessarily just this outward look, it's decreasing inflammation and giving the body these repair signals. Like that's the glow up, and you get to look nice at the same time.
Right. It's interesting that you said that. You brought up that point about the cardio CRP being elevated. So I saw a patient today, and her cardio CRP was 8.4, and she said it had been elevated for many years. Now, she had had some mold exposures, and I checked her melanocyte stimulating hormone level, and it was less than 8, and it should be at 35 or above. So I told, and she had some gut issues as well. So I told her that she should probably add the KPV to that stack because that's a three amino acid fragment of melanocyte stimulating hormone. And when your
Mhm.
stimulating hormone is low, then you are going to have more inflammation. So the KPV actually even enhances the decrease, well, enhances decreasing inflammation. So I had to, I thought about doing the glow up, and then I said, well, okay, so let's do the KPV and the BPC 157. Now, the good thing about BPC 157 is if somebody really is anti-injection, it does come in an oral capsule. So I did a combination of the BPC 157 and the KPV in a capsule for her. And then I also, because she also had a lot of back pain and knee pain, so we're going to do the TB 500 in a much higher dose. We're going to do, rather than doing the 500 micrograms, which is what's normally given in that glow stack, we're going to double that dose and give her a milligram per day of the TB 500.
Sounds
another good
like you kind
example.
of personalized somebody else's glow stack. So commercially, we know that the glow stack is these three peptides, but it sounds like you're able to kind of personalize a glow stack up to each patient and swap out one peptide for the other based on the patient's needs for their glow up stack.
Right. So
I was
I
going to say that's
yeah.
another good reason why having a doctor be involved in this is a good idea because Dr. Lawson's able to check what somebody's melanocyte stimulating hormone is and then give them the ideal peptide rather than just
Hmm.
probably work peptide.
Right. And I told her the glow stack would probably work nicely and she would get some benefit from it. And she said, "Well, what's going to decrease my inflammation the most?" She said, is there enough BPC 157 and TB 500 in that stack to really lower my inflammation?" And I told her that there was not. So she said, "I don't really care how I look right now." She said, "I just want to feel better." So it's nice to really understand what the benefits of each peptide are and not just blanketly, prescribe the same regimen for everybody. You really need to personalize that regimen for the person.
One person's glow up might be outwardly, another person's glow up might be working on the inside and their energy and their hormones. So first you have to understand, what does your glow up look like? And then it sounds like you have to find the right practitioner to understand how all these peptides work together. You want to put peptides that work synergistically together, because not all peptides do work synergistically together, and then match that to the patient's outcomes and needs.
Correct. Right. So I'm excited for this patient. I think, within, the next maybe 2 to 3 months, she will have significant improvement. So it's just another tool in the box, but you have to always get to the root cause of what that person's illness really is triggered by.
Yeah. We kind of touched on this a little bit, setting up expectations for patients who are on peptides or who are going to be engaging in a peptide journey. So I've seen um, people being frustrated with peptides because they saw a peptide, decided to try it out. They tried it out for a month or so, didn't see the results that they wanted to, and so now they've written that off. So when you're talking or prescribing peptides to patients, how do you set them up for success?
Well, for example, if they just want more aesthetic benefits from the glow up stack, I tell them that they will probably notice some differences in 4 to 6 weeks. But I also steer them to be on the right skincare regimen and not just use Dove. So I mean, you have to really, as you age, you really have to do everything. You
You have to
really
look at the
have
lifestyle. It's not
the
just
life.
about providing the peptides, it's really looking at the whole picture.
Exactly. But the peptides definitely have been amazing. I've seen amazing results with them. So yeah, I'm happy that we're able to use them, and that some of them have come off of the do not compound list.
Yeah, that is
And
so exciting.
right, it is exciting. And another thing that people might be experiencing when they're not getting the results that they want or thought they were going to achieve with doing the peptides, it could have been where they were sourced. So a lot of people will buy them online from a research only facility, and you don't really know what's in that vial. You
Yeah.
don't know, sure, you don't know what kind of contaminants are there. You don't know if the actual raw ingredient is what they say it is. So, they have to be sourced properly as well.
So when you're talking to patients about and setting up their expectations, first you look at what's going on in their lifestyle, not just prescribing peptides. You have to understand the whole story to make sure that if you want goal X, peptides are the instructions to your body to get there. Let's look at what kind of other signals and ingredients you're giving your body. So, skincare, are you putting on toxic and hormone disrupting skincare? That's not going to benefit your journey. Also, even your food and your intake, these are messengers, and your body needs the appropriate ingredients and fuel in order to do something with those messages. And so there is more to um, getting the results that you want leveraging peptides. You have to have all of these other steps in place. And then the next thing you had mentioned is making sure you have the right quality and sourcing for the peptides.
Correct.
Awesome. I love that. If you guys could add one other peptide to the stack. So we've got the GHK-CU, the BPC-157, the TB-500. We did talk a little bit about the KPV peptide. If there was another peptide you could add to the stack, what would it be?
I do like the CJC 1295 and ipamorelin because that helps to improve lean body mass. It helps for people to lose body fat. So, and it has a lot of anti-inflammatory and regenerative properties as well. Now, it gets expensive if you do everything, but the combination of, now I think probably the best combination would be the KPV, the
Hmm.
BC 157, TB 500, and GHK-CU, and then the CJC 1295 and ipamorelin is a good addition to that stack.
And I'm
Dr.
a big
Lawson, do you
fan
have
of
a preference for the CJC ipamorelin versus tesamorelin? Do you, what do you see in your experience between those two? Anything different?
The tesamorelin is more effective. That's what I'm using right now. So I do like that. And, I talked to one of the reps from the pharmacies that I use, and he says people are really getting amazing results with the tesamorelin. So it's definitely a good addition as well.
But you don't necessarily see that one is superior to the other. You just there or do you? I
Well,
just
I
asking.
can't,
I don't.
yeah, I haven't seen that personally at this point because the tesamorelin is, much more expensive than CJC 1295 and ipamorelin.
Mhm.
So I definitely see more patients on the CJC 1295 and ipamorelin.
I see. So maybe it is more effective. It's a question of is it, cost
Affordable.
effective compared to it. So
It is more expensive.
yeah, the one that
I'm
I would
also
say
oh,
that I liked that I would add. Maybe this is because I'm an old man, but the CMAX and C-Lank for brain health.
oh, I love those.
So
Yes.
Right.
I, I'm I'm probably more worried about becoming forgetful than ugly. I'm already
Yes,
ugly, so I don't mind.
I'm on the C-Max right now, and you wanna know what? I'm a big fan of cycling my peptides. So, I like, you don't a lot of the peptide, protocols are, like, 4 to 6 weeks, and then you take a break, but you're always taking breaks and cycling with a lot of these peptide protocols, so I just did a round of because to your point, Dr. Peterson, I am brain health, and that is an important part of aging to me right now. My family has a history of Alzheimer's, so I like to be very proactive in that area. So I just did a round of cerebrolysin, and then my next peptide, instead of going right back to cerebrolysin, I'm cycling to right now I'm doing a round of CMAX. The next one that I'm going to do. And so I just don't feel like I need to do everything all at once, but I do know that I want to consistently support those different areas in my body. And so I cycle different peptides to support the different areas that I'm concerned about as I age. And
So I don't know any.
that's how I do my glow up.
Yeah, and that makes sense to me. I don't think we have enough data to say that that's the best way, but it makes the most sense to me, and that's the way that I think we should be moving towards is saying, look, yeah, you could use BPC 157, TB 500, and GHK-CU continuously for the next 3 years. That's fine. But if you can't afford to do everything all the time, then, give your brain a little boost, then give your growth hormone a little boost, then give your immune system a little boost. You can cycle through these things and I think get a lot of benefit rather than focus on only one part of your body. Because otherwise we end up seeming a lot like you're, the way we've fractured healthcare into ologists, I'm a cardiologist or a nephrologist or a gastroenterologist. It's silly. I've only got one body, right? And
Right.
so I need to pay attention to all those things. And so I think the idea of saying, hey, I did this for a month, maybe 2, 3 months, and then I'm going to switch. I like that a lot. It makes sense.
And a lot of the recommendations, they're no standardized recommendations, but what a lot of the experts say is that, so for example, with the glow up, sometimes they'll say, I've read that you use it for 2 months on and then maybe take a month off.
Mhm.
So you cycle these things, you focus on one area first, and then when you cycle off of it, then you add in another peptide that addresses some of the other areas of concern. And just again, you get the best of both worlds when you are able to use everything that addresses all of your concerns.
And personally, I can feel it. There's a peptide, a sublingual peptide blend that maybe you've heard of, Dr. Lawson. What's it called? BioPro. And I'll use BioPro for 2 months in a row, and then I'll take 6 months or 2 months off. And I can tell when I'm like, ooh, I can tell it's going down. I might need to get another box
You
of that.
need to start again.
I think you can
Exactly.
see
Mhm.
the same thing with these other peptides of, I'm using this. The only one that I don't feel a difference in is the growth hormone one. the CJC, ipamorelin. And maybe it's because I'm not, my weight is fine. I'm not trying to lose weight. I just don't notice it, but I notice the other ones. And that doesn't mean that I don't use it. I still use it because I figure, well, I need growth hormone. I need to repair sometimes.
Right.
Yep.
And maybe
I
your
think,
IGF level was good to start, and
Right.
and
yeah,
so you didn't get a lot
you're
of
just
benefit.
supporting the body. I think too, like with peptides like CJC and ipamorelin, if your goal and your outcome is to increase your muscle mass, or if you have specific body composition goals, I think one of the biggest things that you have to do with your patients or just as a person using peptides is track your goals. Like you should be hopping on an in-body once a month. You should be making sure that you're getting a high intake of protein. You should make sure that you're doing muscle resistance and things that are promoting and adding to the peptides, because I wanted to bust this myth before we ended. Myth or truth, peptides replace healthy habits.
Absolutely a myth.
Definitely a myth. If you're
Right?
smoking and drinking alcohol and eating your processed foods, you might as
Exactly.
well waste your money on the peptides. You really need to be committed to doing everything. I mean, nobody's going to be perfect all of the time, but you need to be pretty consistent about your lifestyle and living a healthy lifestyle about 80 to 90% of the time.
Exactly.
Mandy, you could think about it like building a house. If I have twice as many framers, plumbers, and HVAC guys show up, but they don't have any 2x4s or pipe or wire, they're not getting more work done, right? And
No, they're
so
just
it
sitting
doesn't matter
around.
how many peptides you take, if you don't have the basic building blocks and your autonomic nervous system is not in a state where it can say, let's repair, it's not going to work. If I'm in a fight or flight state, my autonomic nervous system says, hey, we got to escape from the tiger. Well, it won't help me that much that I took tesamorelin. It'd be a good time to take BPC 157 and calm down the fear, right? And that's why you want to
Hmm.
see a doctor to help you do this. Because if you're taking a peptide without doing all those other steps, they're just really
Yep.
expensive.
And
Right.
that was my myth or truth. Peptides replace healthy habits. Absolutely not. It is 100% false. It is a myth. And people should be, if you are taking a peptide, what is your goal? You need to ask yourself, what is the outcome you are looking for with this peptide? And you should be tracking it. And when you are taking that peptide, CJC and ipamorelin is a really great example. If you're looking to goal increase your muscle mass, because that is a recomposition body type of a peptide, you need to make sure that you're following the lifestyle to support the peptide and the outcome that you're going for. Peptides are the messengers. You still have to have the right tools and the ingredients in the body for those messages to have an action and result at the end of the day.
Yeah, I agree. 100%.
Well, this was such a powerful conversation. Thank you guys so much. My big takeaways are one, I learned so much about the glow up stack and GHK-CU, TB500, BPC157, but also just the overall concept of stacking and what the glow up stack means in general is you're looking to have a glow up. And if you are looking for a glow up, it doesn't have to be just these three, but working with a practitioner can really, one, customize the peptide stack to your outcome and goals, and make sure that those peptides work synergistically together so you are maximizing your outcome.
Absolutely.
I love it. I love
Yep.
it.
Thanks for letting me join. I really appreciate Dr. Lawson, your expertise on this. It's great for the organization, and I know it's great for your patients.
Yeah, I'm really happy that we have that in our toolbox. It makes a huge difference because, again, I've had two people say to me, "Oh my goodness, these peptides, well, particularly the BPC 157 and the TB 500, have changed my life." So it's good to hear. You always hear the negative, but it's nice to hear something positive.
Yep. Amen.
Absolutely. Well, you can find practitioners like Dr. Lawson and Dr. Petersen on our website at forumhealth.com. Thank you so much for listening, and stay tuned for next week's episode. If you liked this, don't forget to like, comment, and share with somebody who can benefit from this podcast also. Thanks so much and have a great day. Bye.
Thank you. Bye-bye.
Thank you for joining us on the Forum Health Integrative Medicine podcast. Each episode, we help you understand your health from every angle and inspire your lifelong wellness journey. Follow the show, share it with someone who needs hope, leave a review, and take the next step toward feeling your best at forumhealth.com.